Focus on your health at 6 o'clock. The CDC continues to warn of high respiratory virus activity all across the country. ABC6 News reporter Lara Lynn Jackson went to find out the risk level around here.
As temperatures drop, respiratory illness rates are rising. The Rhode Island Department of Health says COVID-19, the flu, and RSV cases are on the rise. On January 4th, Lifespan Microbiology Labs reported 145 positive cases of SARS-CoV-2 and 223 cases of RSV for RP2. In comparison, last year at the same time, the state had only reported 93 positive RSV cases. Experts are keeping a close eye on these trends.
One thing that's important to emphasize at the outset is this is really different than the COVID-19 pandemic in the sense that that was a virus that we'd never seen in humans before. And the viruses, the respiratory illnesses that are on the rise right now, these are things that unfortunately we regularly see in the human population.
Gavin recommends a simple tool that can help reduce the risk at home.
In our homes, there's some good data to suggest that humidifying our homes actually helps reduce the risk of getting or spreading these respiratory diseases. So I recommend a humidifier if you can get one.
Hand hygiene is another crucial measure in preventing the spread of these illnesses.
As we say that hand washing is important for respiratory viruses, it's really important to use soap and water because only soap and water interrupts transmission of norovirus. The hand sanitizer doesn't have enough, most don't have enough concentration of alcohol to inactivate it.
While everyone is susceptible, certain populations are more at risk.
Primarily older folks and people with chronic medical conditions like heart conditions or lung conditions, diabetes, things like that, for sort of all three of them. So, the concern is really for those people who are at risk.
With the flu season in full swing, vaccinations remain a key defense.
Listen, if you haven't gotten vaccinated, particularly for flu, there still is time. Go out and get it. Flu seasons can last into the spring and sometimes even a bit longer depending on when they get started. So there still is time.
Nuzzo also points out another advantage we have now compared to past seasons.
Another great tool that we have now that we didn't used to have is you can test yourself at home, and not just for COVID-19, but also now for influenza, which is really great because there are some medicines that can help people potentially experience less severe illness if they become infected.
Experts recommend staying informed and using available resources to protect ourselves. For more information on how to prevent these respiratory illnesses, visit abc6.com. In Providence, Lara Lynn Jackson, ABC6 News.
Now to consumer news at 6 o'clock.